Hi guys, welcome back to another video from the Aspiring Medics. My name is Yusuf, I'm an Oxford medical student. I'm also joined by
Shakira, I'm a final year student at St George's.
And today we're going to be going through a role play scenario. And firstly, we're going to start off with talking about type 2 diabetes, and I'm going to be showing you how to do it badly firstly so you can learn from it. Alright, so it's all about a consultation and you'll see it on screen now. Hiya.
Hello.
Hi, I think you've come in today about your diabetes.
Correct, yeah.
Is that right?
Yeah.
Fine. Can you tell me a bit more about that?
I mean, the doctors just told me that I have type 2 diabetes. They said that you'll tell me a little bit more about it. I guess I have like a tiny... I know a tiny bit, but like I don't know anymore.
Yeah, to be honest, it's quite simple really. So basically, type 2 diabetes is kind of a mixture of both like genetics and environment, and effectively it's down to different sort of metabolic pathways going a bit weird, and we think it's also down to something called inflammation. And what that can then result in is basically an imbalance when it comes down to your hormones, and there's different processes, gluconeogenesis, glycolysis as well. And basically what that can all mean is that actually it can all go a bit eerie, if you like, and just all go a bit wrong in terms of your glucose metabolism, and that's something we really want to get under control. And there's a variety of factors. I mean, we can consider lifestyle factors, we can consider medications, or we can indeed consider anything else that we might also need to be doing, and potentially being on insulin as well for the rest of your life. That's one consideration we want to really take into account.
So I need to be on insulin for the rest of my life? No,
not at the moment, but we just want to sort of think about it, sort of like a spectrum really, and that's something we want to sort of consider.
Oh, the doctor didn't tell me anything about that.
Oh really? Oh fine, well I'm telling you it now, so that's all really that matters. And as I say, we want to get it under control at the moment in terms of your sugar levels, particularly because it can cause loads of complications in the body, including in terms of eyes. It can also increase the risk of cataracts, of blindness.
Blindness?
Yeah, absolutely, and also heart attacks and cardiovascular complications, strokes, and also limb ischemia. So you might start not feeling your nerves in your toes and your feet, and that can also result in amputations as well, so it's really important.
I'm gonna lose my leg.
I mean, not exactly, but it's something we definitely want to get under control at the moment. As I say, it's really important that we take it under control, particularly think about lifestyle. So, you know, it's very common for, you know, people like yourself or whoever it is really to be having lots of sugary foods, so we're going to be cutting down on that. Carbohydrates, you know, carbohydrate foods.
So it's something that I've done?
Partially, yes, yeah. So that's what we're saying, that we want you to now be able to really sort of take ownership in a sense. We want you to be able to make the most out of your situation. As I say, I think in terms of food is the main thing. As I say, otherwise, you know, it can cause all those complications that I said. Any questions on any of that?
I don't think so.
Alright, well, all the best, and speak to you in 6 months' time, alright?
Okay.
And obviously that's an example of how to do it very badly. You saw that I wasn't really speaking to the patient as a patient. I was treating them almost more as like a condition in a petri dish as opposed to an actual person that's got feelings, that's got emotions. And it was also very clear that I wasn't actually communicating in a way that was actually applicable or appropriate to a patient. I was using unnecessary jargon that clearly wasn't doing a really good job of explaining the situation to the patient. I was going too fast, using lots of jargon, and also I was giving way too much information at a time, and of course the patient's going to be feeling potentially a bit anxious, a bit scared, especially if it's the first time that they're hearing about this condition. And so we want to make sure that we're grading it to the patient, and we're making sure that we're actually taking the patient with us on that conversation. And at multiple points I didn't check the patient's understanding, I didn't check how they're doing so far, I didn't pick up on their body language, on their expressions. And so picking up onto all of these things is really, really important. Shakira, how did it feel as the patient?
Yeah, no, I mean, it was an information overload essentially, and there's no way you can process any of that information, and especially when you don't know much about it as well, it's so important to pause and check. And I think as a patient, when you are diagnosed with conditions like diabetes where lifestyle factors might come into play, it's really important not to create a culture of blame, and actually provide agency and empowerment to patients to take essentially to take ownership of their health and things. But yeah, language is very important, and I can see here that it was very much a disconnected conversation, and I didn't feel empowered, I didn't feel supported, I just felt sort of blamed and information dumped. So it's really important to gauge how your actor or your patient in future will be feeling when you're having these conversations, because one approach will not fit or patients.
Yeah, absolutely. And I think the key thing here is the way that you actually approach in terms of language, and in terms of, I think the key word there is empowerment. And absolutely, diabetes is ultimately a mixture of both environment and genetics, and in terms of behaviour. And yes, there are adjustments that can be done in terms of behaviour, but you want to do that in a way that's empowering the patient and not in a way that you're blaming them for their condition in that way. Because ultimately, that's decreasing the doctor-patient rapport, so that if they do get any symptoms, the ones that I listed, then they're not likely to come to you because they're going to likely feel blamed and they're not going to want to present. So all of this stuff is really, really important when it comes down to patient care. Okay, so in this scenario, we're going to be going through an MMI roleplay and specifically about breaking bad news about a cake that I accidentally dropped and how I go about that in terms of explaining that to a customer and next steps. So let's get into it. Hiya.
Hi, how are you?
I'm good, how are you?
I'm alright, thank you. I'm really looking forward to collecting the cake today.
Yes, I appreciate it's for a special occasion.
Yes, it's my mum's 50th, and yeah, no, honestly, firstly, just thank you for doing this for us. It's such a special occasion. It's really personal for us as well. So yeah, just waiting to get it and go now.
Sure, and when's the occasion?
This evening,
This
so
evening.
yeah, that's why I'm collecting it now, so we can have it for the day.
Okay, so in a few hours' time.
Yes, yeah.
Okay, alright. I'm really sorry, but I've actually got some bad news to share with you about the cake. I'm really sorry, but I accidentally dropped the cake.
What?
Again, I'm very, very sorry.
What do you mean you dropped the cake?
It happened this morning, and it's something that I've had to escalate and I'm speaking to our manager about.
I don't understand. We explained just how important this day was. How can something like this have happened? What do we do now? We've got an event in a few hours.
So firstly, again, I apologise massively, and this is something that I take full responsibility for, and it's something that...
This isn't the service we paid for. This is ridiculous.
Yeah.
What do we do?
Yeah, I completely understand your frustration. To answer your question, we're going to see if we can get you a replacement cake ASAP for the few hours' time. And if we don't have it in store, it's something that we can also speak to our different branches in town about as well, to get your replacement cake and obviously get it with the decoration that you need in time.
Yeah, I had such specific requirements. How would you get that in a few hours? That's why I gave you such a long time to actually meet those things. This is for my mum. We only get this chance once. I don't understand.
Again, I massively apologise, and as I say, because of the situation, we're going to be able to do it as a speed order, and it's something that, as I say, I've escalated to our manager, and that we'll be able to further ensure that this obviously happens and we can meet it within your deadline. We can also see if we can sort of sort out delivery as well for you.
Yeah, absolutely. I came here to collect it now. I can't come back.
Yeah. So we'll sort out delivery for you as well, and a replacement cake that we'll do ASAP. As you mentioned, obviously, this is not the service that you expect from us. And then we're also going to see what else can be done in order to make up for it, whether it be a voucher for your next event, for example. And it's, again, I can only apologise.
Yeah, I mean, I appreciate that you're going to try. It's obviously just not going to be the same, is it? And it's not what we paid for it, but I guess please do, can we get that sorted this evening? Because there's nothing I can do in time for that.
I completely understand. Obviously, this is quite time limited, so it's something that I'm looking into right now. I've re-escalated to my manager as well to get your replacement cake, and as I say, we'll do our absolute best to ensure that that's done and that's also delivered for you in time for the event. So obviously, a big event, as you say, it only happens once a lifetime, so it's something we're going to ensure that we can actually deliver. All right.
Yeah.
Thank you for your time, and again, appreciate your patience on this.
Okay.
Okay, so in this station, I have to explain that one of my colleagues lost a patient's letter, and you're going to see how to do it badly, and you can see the key learning points from this, and we'll be able to discuss it later on. Hiya.
Hi, so I'm here because I'm still waiting for an appointment.
Yes.
I gave you guys at the reception a letter last week. I'd been to the hospital and they'd had some investigations on my heart, and they wanted the GP to basically follow me up with it.
Yeah.
I still don't have an appointment.
Okay, I'm really sorry, but actually the letter was lost, I'm sorry to say.
Lost?
Yes, it was lost in transit. We don't know exactly where it is, but we're going to have a look.
What do you mean? But I handed it to you guys. It didn't get delivered here. I handed it to you.
Oh, well, it's just on the system, it's got lost in transit.
how? I gave it to you. They said that they're just gonna scan it and then the GP will give me a ring.
Oh.
But it's been a while now. Like
Yeah.
they did say this was an urgent. I don't understand how it's been lost.
Do you know who you handed it to?
Yeah, it was another male
Okay.
colleague of yours, and he said it was going to be. He just said this is absolutely fine. We just need to scan this in.
Yeah.
And I only have one copy of that. You know how difficult it is to even get to see a doctor in a hospital. How am I going to go and grab another letter?
Okay.
Well, will the GP not see me if I don't have a letter?
So I'll look into that. Do you know? Was it Jeff? Was it?
Yeah. I
Yeah,
think
because he works. Okay. I'll see what can be done there.
Well, where is Jeff? Is he here? Because I'm pretty sure he'll remember that I gave it to him.
I'll see if he's around actually. Do you want to speak to him?
Absolutely.
Yeah.
But this isn't the sort of stuff you're supposed to be living with, and this is meant to be where I get my help from.
Yeah.
You can't just have lost my letter.
No.
How does it get lost on a computer system? That doesn't make sense.
I completely understand. Like, it's completely unacceptable.
And your doctors aren't going to see me then if they don't have a reason for it.
We'll look into this and see what can be done.
Well then, can you ask him to come here? Because I'm pretty sure he'll remember.
Yeah. I'll get Jeff to come over here. It's completely unacceptable what Jeff did, and I need to look into this because obviously what Jeff did just isn't right. And obviously if it's affecting you and your health, like I completely understand.
Well, yeah, of course. I can't even get to see a GP for months and months, and when I do, I ended up in hospital. And now when I need your help, you told me you lost my letter. How does that work?
I say I completely understand.
But yeah, no, you need to call him over. I don't really understand. He needs to come here. He knows where it is.
Sure.
There's no excuse for that. I handed it to him.
Sure. I'll call Jeff over. We'll do an investigation into Jeff and see actually what happened there.
Yeah.
Because this shouldn't be happening.
No, absolutely. We're supposed to trust you.
Yeah, exactly, and go from there.
Okay.
All right. And obviously that's how not to do it. So we clearly threw Jeff under the bus there. And there's a lot to think about. So within the NHS, it's all about having a no blame culture, and that's really, really important. And yeah, the system did say, oh, okay, lost in transit, but it's worth thinking about what exactly could have happened. There are multiple steps that could have happened in that step process. And so it's important to actually do an actual investigation to have a look at what happened and not start pointing fingers, and certainly not say, oh, okay, then let's bring that ex-member of the team in front of a patient because we think that they might be responsible or guilty. So it's really important to have that no blame culture, and you can absolutely apologise on behalf of the surgery or whatever it is, but you don't necessarily need to then say, oh, okay, we're going to blame that person. I think that's the key takeaway there.
Yeah, absolutely. And I think just from like a patient perspective as well, it doesn't help with de-escalation techniques either, because all it does is continues to fester anger as opposed to providing a more calmer and rational way of thinking on both sides. And certainly it doesn't provide any sort of plan or steps forward. All it does is it continues to aggravate and frustrate the patient, which isn't helpful for the health and for anyone else that's listening, and it doesn't provide that trust in the services either, and it shouldn't be on one person. So definitely in terms of de-escalation, trying to think about how best to calm the patient down and support them as opposed to continue to aggravate them.
In this scenario, a patient only wants to see a chiropractor for their chronic back pain, and we're going to go through how you can go about that. Hiya.
Hi.
How are you?
Yeah, I'm good, thank you. How are you?
Yeah, very well, thank you. I understand that you've got some back pain at the moment.
Yeah. For a while, to be honest, but it's just starting to get a little bit problematic now.
Okay, could you tell me a bit more?
Yeah, I mean, it's just affecting my day-to-day. I suppose you don't realise how much you need your back until it goes.
Yeah.
But yeah, just walking, sitting, lying down, nothing's really helping. Nothing helps, and it's always painful for me, and that's, it's no way to kind of be at the moment. So yeah.
I understand that obviously this is the second time and we've spoken a bit about this.
Yeah, exactly. And I think from the first time you told me to really take medicines and stuff, but I'm not really keen on that. So yeah, it's still a problem, I suppose. I'm just but I am seeing someone for it. So yeah.
Okay. And could I ask, is there any particular reason as to why you don't want to take any pain relief, or?
I don't know. I don't think it helps. Like, especially, I mean, you take paracetamol for the odd migraine or headache or whatever, but I don't think it's enough for a back pain. And I'm not keen on taking medication. I'm telling you that my pain is every day. I don't think it's healthy to take a drug every day, and yeah.
That's understandable, and obviously you've mentioned that, you know, it has quite an impact on you on
Yeah,
a daily
yeah,
basis.
definitely.
At work, at home.
Exactly. Everywhere.
Yeah.
Can't relax, can't work, and you just seem a little bit older than you are as well, and it's just, it's not great, and everyone thinks you're making excuses, and you know, your medicines don't work, so yeah.
And does anything actually work for you?
Yeah, I'm actually seeing this another doctor.
Okay.
It's a chiropractor actually, and I think that's the only thing that's like what I want.
Yeah. And could you tell me a bit more about that?
Yeah, no, I try to go and see them every few weeks, and I have they do their treatment, and for me, I feel like they actually listen, and they actually know what I'm talking about, and they get that I'm struggling with this day to day, and I feel like I've gotten some relief with that, but you know, I suppose I'm here again because it's still problematic, and I don't know.
Yeah, so some people do find that chiropractor can work, and that is something that you can do. What I would say is that at the moment, based on what we use in terms of like an evidence base at the moment, there isn't a lot of evidence for chiropractor, but some people do find that, you know what, it does work for them. If it works for you, go for it. And if that has been the case, and you know, you're able to afford it and carry on with it, no problem.
I suppose so. I mean, more than the money, it's the health and trying to live, right? And I don't know, I feel like I come here and a lot of the time doctors seem quite rushed, and I go to the chiropractor and they actually have a little bit more time to talk to me as well about what's going on, and
Do you feel like your pain is exacerbated by anything?
I suppose when I'm working a little bit more and I've got a little bit more on my shoulders, it is a bit worse, but chiropractor helps with that.
Yeah, just being able to just relax a bit more.
Yeah.
Okay, so that is absolutely something you can carry on doing, and indeed medications aren't the only way we can treat something like chronic lower back pain. You can also consider something like cognitive behavioural therapy. Have you heard of that before?
Not really, but isn't that just like the mumbo jumbo for like, well, I don't think this is a mental thing. Is that what you're saying?
No, so pain in itself can be caused physically, but it can also be caused mentally, and also can be caused by a combination of both of those.
Okay.
And actually it can be particularly useful for people who actually have this chronic lower back pain for over a long period of time, and potentially if it's not responding to medications, and that's completely understandable why you don't want to take medications every day, particularly paracetamol or ibuprofen, for example, when they can obviously have their own side effects associated with it. That's completely understandable.
So is it not like going to help me just to keep going with the chiropractor?
You could do it in addition with your chiropractor that you have currently. Yes, that is one option that you can do. So as I say, cognitive behavioural therapy is something you can do, where it's basically looking at your mind, your thoughts, your actions and behaviours. And basically there's a lot of synergy between all of them, and effectively it can be a very useful tool, and there's a strong evidence base behind using it actually for pain relief.
Yeah. Okay. I suppose, I mean, I can think about it, but I feel like maybe. Well, I was hoping you'd say that just continue with the chiropractor would, in the long term, be a good thing, because you were going to suggest like long-term medication.
It can be something you can do, and that's completely your choice. So firstly, what you choose to do is completely your choice.
Okay.
And if you feel that for you personally that does work for you, that's great. It could also be that just by chance, giving it time just means that it will improve anyways gradually by itself, and that's one option. But also, if you do feel that your pain relief and your back pain is actually getting a lot worse now, and pain relief isn't working, do let us know as well, because that's something we can also escalate as well. And we've also spoken before about like if you have any nerve damage or anything like that, that's always best to speak to A&E too, and go straight for A&E for. All right.
Thank you. Thank you.
Okay, so in this scenario, I'm going to be speaking to one of my teammates as part of an events coordinator role, and effectively the teammate that I'll be speaking to hasn't been able to meet any of her deadlines, so we'll be able to discuss this further. Hi Shakira.
Hi Yusuf.
How are you?
Yeah, getting on.
Do you know why we had this meeting today?
Well, I mean, I probably have an idea, I know you probably think I'm like not doing what I need to do as part of the group.
Yeah, I just wanted to firstly check in with like how you're doing.
I'm not fantastic, but I mean, I'm trying my best. If you just give me a little bit of time, I'll try and figure things out.
Yeah, would you be able to tell me more if you can about what's going on?
Yeah, no, I'm just having a lot of stuff going on at home, and I'm not usually like this. I mean,
Yeah.
it is why you kind of asked me to be the events manager in the first place.
Yeah.
So it's disappointing for me, like, to be sitting here having this conversation with you. But yeah, a lot's going on at home. We've just had a death of a family member recently, and it's just I'm kind of responsible for coordinating most of that because I'm the one who can. So yeah, it's just not been aligning well with our work as well. So yeah.
I'm really, really sorry to hear that, and I hope you're okay.
Yeah, I guess so. I do feel bad. I know I should have been better here.
No, not at all. Like, that's honestly completely like understandable. And if you do feel like you need to take that time off because of bereavement, that's absolutely fine. And obviously, if you do want to talk about anything, I'm here for you. If you do want to get anything off your chest from that side of things.
Okay. I appreciate that. I do. I know we have the deadlines for the speakers, and I haven't really been able to ask anyone to come in. I know the event's like this week, so I didn't really know how to tell you about that either, and I'm not sure what to do going forward, really.
Yeah, I guess the thing is, like, if you do feel as if you're at capacity, as if you've got too much on your plate, please do just let us know. We don't want you just to be suffering in silence, and the sort of earlier and sooner we know, the better. Just so we can sort of plan things around it, and obviously it's completely understandable, particularly given how recent things are, and by the sounds of things you've got quite a lot on your plate, and maybe you can consider actually sharing your role with someone else, for example, at least for now, just to take up that burden for now.
Yeah, definitely. I think that would be helpful.
Just to give you some time off, just so you don't need to think about that as an added stress, because by the sounds of it, you've got quite a lot going on already, and then we can see how things are after this event, and move forwards from that perspective.
Okay.
If you've got any of your current notes or anything that you did do in terms of like email drafts,
yeah, definitely.
if you could like send that over.
Yeah, I do have like everything just mid-place and all the numbers
Yeah.
and things, and I'm more than happy to share that. I just felt a bit embarrassed really that I wasn't able to kind of meet that deadline when I usually do. So yeah, I can pass everything over.
Yeah, as I say, like, I know you're absolutely incredible at your job, like, there's no question there, but I just feel like at the moment you've just got a bit too much going on, which is absolutely fine. That happens to everyone. So I feel like if we just take a pause now, and if you just focus on you at the moment and your own well-being, to your family, I think that's the most important thing for now. We can share your role with someone else for now, get your resources transferred over, and then go from there.
Okay.
Right.
Thank you. Okay, and in this scenario, Yusuf is going to be a medical student who is speaking to first-year university students who are coming from different countries about how the healthcare system works in the UK. So we really want to think about how he is providing this information and thinking about the key points that would be helpful and how he delivers this information as well.
Hi Shakira, how are you?
I'm fine, thank you. How are you?
Yeah, good, thank you. So I think you wanted to find out a bit more about like where to go to if you're ill.
Oh yeah, definitely. It seems a little bit confusing in this country.
Yeah.
There's so many different places, and
Okay.
I'm not sure.
Yeah, that's absolutely fine. What's your current understanding about like how it works at the moment?
Well, it's a little bit different to how I know, because we just used to like go to the hospital, get your treatment, and pay for it. But I'm not sure exactly how it works here, because we obviously are with the medical school, and I see people coming into hospital, but then I also see like we have other things like general practice and things, so I'm not sure like what the exact difference is between them.
Okay, yeah, sure thing. So firstly, the first thing to say is that if you're ever ill, you can always go to a hospital.
Okay.
If it's a serious condition that you feel like is life-threatening, you can go to A&E for, all right? So for example, if you're bleeding, if you feel like you're having a heart attack, for example, anything like that that you feel like is an emergency, literally accident or an emergency, that's where you would go to A&E for, or straight to hospital for.
All right.
And you can either go there directly, so you can drive there or get a taxi there, or you can also call 999, who can then call a paramedic, like an ambulance, to come to see you, and they can have a look at you, see how you're doing, might give you some medication stuff, and depending on that, then decide whether to transport you to hospital. Does that make sense?
Yeah, fine.
There's also GP, and that's somewhere you can go to if you've got any other problems that's not quite as urgent, or is not an accident, or is not an emergency, all right? So it could be anything at all. from coughs, colds, infections,
Okay.
to having anything, a problem with your skin, for example. It can literally be anything that's sort of healthcare related. That's something that you can go to a GP for.
Okay, so like GPs, can they do everything that the hospital does as well? So I don't need, because I mean, if the hospitals are for emergencies, maybe I should avoid that and just go to GPs for everything.
So a GP, as I say, if it's not life-threatening
Okay,
or accident
fine.
or emergency, you can go to a GP.
But they can still do the same like tests and stuff like as a hospital.
Not as many tests that they can
fine,
do. They won't be able to do like scans, for example, but they can they're definitely your first point of call if it's not an emergency, because if not, they can refer you at least to a hospital or the right specialty.
Okay, so you can't just go to the hospital and ask for a specific type of doctor.
No, so what we've got is something called primary care.
Yeah.
So depending on, as I say, if it's an emergency or not, you'll go through A&E or you'll go through GP.
Sure.
And dependent on that, either they'll be able to treat you, if not, they'll then be able to refer you on to the right person.
Okay,
Right?
yeah.
Does that make sense?
Yeah, that's fine. And I'm not sure, because I've seen we can get all our supplements and things like that from the shops. But if you do need like medication, do you have to go to the hospital for it?
So if it's medication that you're already on,
Yeah.
you can speak to a GP or pharmacist about that.
Oh, okay.
You'll probably need a prescription from your GP firstly,
Okay.
and then your pharmacist is where you'll be able to go to a pharmacy where you can then pick up that medication. If it's something quite minor, so for example, if it's a fungal infection or if it's something you've got a problem with your skin for, depending on what it is, you can actually also speak to your pharmacist about it.
Fine.
And similarly with coughs and colds as well. And if they can't deal with it, as in the pharmacist, you can then speak to the GP. And if the GP can't deal with it, they'll then be able to refer you on to the right people.
Fine.
Does that make sense?
Yeah, and you mentioned 999
Yes.
as a number, right?
Yeah. And there's also 111.
Oh,
so
okay.
that's what you can call if it's a non-urgent issue, but it's still something that you feel like you want to speak to a healthcare professional about. So it's not quite an emergency, but it's something that you can then speak to them about if you're unsure of whether you should go to A&E or not. So if you're kind of in the middle ground between GP and A&E, that can be a good point of call. Does that make sense?
Yeah, fine, that's all right. I'm just going to write all this down as well. Yeah.
I appreciate it a lot. Obviously, we've got the website, obviously we'll be around as well. And the other things to say is that it's free for you as a student, and also as students we also get it for free. You can complete a certain form as well.